My name is Zangam Sakozwi, the founder and co-founder of Medsearch Zambia, and I'm joined by my colleague, Dr. Moses Mata. Like we promised, today we're talking about mental health and suicide prevention. I'll allow Dr. Mata to come in now.
Good evening, everyone, and thank you, Zanga. For some reason, Zanga has decided to take a back seat today, even though I know he has a very, very vested interest in all things mental health. But I am also happy today that we are joined by someone I consider to be a friend, a professional colleague, someone I've known for a very long time. We're joined on Medsearch on Friday by Dr. Naeem Dalal. You may know him as Dr. Ganizo on social media. He is a medical doctor. He is a psychiatrist specialist. And for the purposes of this talk, we had to get him because Dr. Dalal is one of the leading mental health advocates in Zambia. He is the founder of the Ganizo Initiative, which focuses on advocating for mental health and mental health issues, not just in Zambia, but in the region and globally. He sits on many advisory boards representing Zambia and other low middle income countries to have the needs of people like you and me who are living with mental illness, mental health issues represented at the decision-making tables. So it is a privilege to have Dr. Dalal join us today. I will call him Naeem because we roll like that. Dr. Dalal, welcome to Medsearch on Friday.
Thank you for having me, Dr. Mata. I'm happy to be here.
Great. My friend Zanga will come in once in a while, but usually we like to just have these conversations with our guests, and we like to invite people who are doing great work in certain fields to just come and share their experiences and just engage with our community. For the past week, we've been sharing information on our social media about mental health, what it looks like, what some of the causes could possibly be, and importantly, how do people go about getting the help that they need? Where do they go to get the help that they need? And how can we as a country, as a society, support people living with mental health challenges? And I think this is very important now. We've seen what seemed like a rise in young people, especially harming themselves, committing suicide, and we'll talk more about that. But I think when we talk about mental health, it's more than just that. And that's what I really want this conversation to be about. So I guess my first question for you, Dr. Dalal, would be, when it comes to mental health in Zambia, how big of a problem is or are mental health issues in Zambia?
All right. So to start with, I often like to just start from the basics where we define health. And when you look at the complete definition of health, we say it's a complete state of physical, mental, and social well-being, and not just the absence of disease. So just looking at it holistically, health is mental health as well, just as much as we give importance to physical health. Now, talking about Zambia here, right here in our country, it's an alarming concern. It is a public health concern because we see a lot of people come through with mental health symptoms. And then we also have to understand the difference between what mental health is and what mental illness is. Because Dr. Mata, everyone has mental health. You and I have mental health. But the difference is at what point does it become a mental illness? So when we talk about mental health, it's there in every one of us. But when we talk about mental illness, it is something that is seen in our day-to-day practice because 1 in 5 to 1 in 4 people do have a mental illness. So talking about Zambia, we are no different. We do have mental illnesses amongst us, amongst people that we live with. from all spectrums of life, from children, adolescents, youth, to adults. So to answer your question, it is prevalent and it is present amongst us in our country.
Right. So touch a bit more about the distinction. I think that's very important. Um, just really differentiating. You say that all of us have mental health, but then it's differentiating mental health from mental illness. And a lot of the times when people think about mental illness, we have this image of people who are walking around the streets naked and screaming and having hallucinations. But that's not the only manifestation of mental illness, right? Could you just walk us through some of the other common mental illnesses that you encounter in your practice?
Yes, so to further communicate on what I meant by everyone has mental health. So the term mental health itself and mental illness are sometimes interchanged, but they differ in meaning. While mental health actually refers to anyone's state of mental, emotional well-being. On the other hand, mental illnesses are diagnosed conditions that affect thoughts and behaviors. So there is a difference. Though anyone can have moments of, say, poor mental health, such as low mood, but not everyone who is experiencing low mood has a mental illness. So we need to often be very clear about this. It's like saying, if you have a lowered immunity in your physical health, there is a high chance that you are going to have recurrent flus, common colds. But that doesn't mean that you are physically ill. It just means that your immunity in that moment is low. Similarly, with mental health, there are times that we feel overwhelmed and our thoughts, our feelings, our emotions, our behaviors may not be 100%. And that is what mental health is. But when you talk about mental illness, we actually talk about our ability to perceive our day-to-day reality, our ability to feel, our ability to think, our ability to act, and our ability to be productive, be functional in our daily activities. If you're one person who is working, being able to concentrate at work and be productive. If you're someone who is in school, then being able to concentrate in class and be able to be functional in class. If you're one person who is at work, at home, then you should be able to carry out your day-to-day chores. So this is what we talk about productivity and functionality. Now, coming to mental illnesses and mental health disorders, again, I like to use the word spectrum because a spectrum literally means that no two people experiencing the same condition are the same. It simply means that we are all very different. But when it comes to common mental health disorders or illnesses in our country, starting from the admission criteria that we see in our mental health departments in the various hospitals here in Zambia, usually the first cause of admission would be substance use disorders. So what are substance use disorders? Things like alcohol misuse and abuse and intoxication. So that's one. We also talk about other over-the-counter drugs or other illicit drugs, such as opioids, or we also talk about others such as cocaine, which is very common. And of course, there's also this debate around cannabis, marijuana, which is also something that we see a lot in our practice. Then apart from substance use disorders, we also see mood disorders. Now, mood disorders are extremes of feeling very low or feeling extremely excitable and high. So we have clinical depression. Then we also have bipolar mood disorder, which is also commonly seen in our practice. Then, of course, Dr. Mata, we also have, the thought process that people have a stigma towards mental illnesses, where, when you think of a mental illness, we often say Chinama case, and you think of someone on the streets who is, picking garbage. And this is where we talk about psychotic realm of disorders. And this is where we have conditions such as schizophrenia, which again is a very common mental health disorder that we see in our practice. Then we have psychotic disorders such as brief psychosis, which again, it's a temporary break in your mental health and it leads to a mental illness, but it's not lifelong. Once you have it, you are treated, you may not have it again. So there are a lot of different disorders, Dr. Mata, but these are the common ones. Then, of course, our country having infectious diseases such as HIV and syphilis, these also ending up with individuals who may be living with HIV or syphilis may end up having signs and symptoms of mental health as well. So they are tailored to Zambia. These are majority of the times of the common reasons why we see people coming in with mental health illnesses. But again, it is a spectrum, just like physical health, where we have so many different diseases. Even in mental health, Dr. Mata, we have many different types of mental illnesses.
Thanks for that. And it's really enlightening just thinking and hearing you talk about the different spectrums of mental illnesses that we have out there. And kind of highlights how important it is that we don't lump everyone into one big thing to say, oh, all these people have mental illness. It's more nuanced than that. The very small little differences. But I think why I'm asking this is right now, over the past couple of weeks, months, and everything, as a country, we have seen incidents on social media and the news of people taking their own lives, especially young people. And when you follow the conversations, it sounds as if everyone is saying that, oh, they've all had mental illnesses, and that's being put as the beginning and the end of why they ended up harming themselves. Tell us about suicide rates. How common is suicide in Zambia, globally? What we're seeing now, a really big spike, or have we actually already been living in a point where suicide is very, very high to begin with, and then we're just now making it more public as a country?
That's a very heavy question, Dr. Mata, and I say this because you're talking to someone who has been talking about suicide. And I think I'm going to, since this is just a casual discussion as well, and a lot of people are listening in, if you know those people who sell batteries and then they go like, "Ma battery, Yoshira, Yamoto Katigura." You know, I'm that person when it comes to suicide. And I feel this is exactly where we are as a country. We have sensationalized suicide. We're not looking at suicide as a mental health concern. We're not looking at suicide as a health concern. We are not looking at suicide from the perspective of public health, but we're literally just sensationalizing suicide. So, and again, the other thing is let's look at statistics and prevalence rates, understanding how common suicides are. And I'd like to start with statistics. The very first statistic is that the second to third leading cause of death amongst people age ranging from 15 to 29 years of age is death by suicide. So second to third leading cause of death, right? From 15 to 29 years of age is by suicide. And this is a statistic that has been there for the past 2 to 3 years, which is no different than in Zambia. In my practice that I've been practicing in mental health for the past 5 years, we have been seeing a lot of people coming in with suicidal attempts, suicidal thoughts, and completed suicide. So it is not that we can just infer or say right now to say suicide cases have gone up. No. But what we can say now is that because of social media and what COVID-19 has done to technology, there's more and more people communicating or sharing suicide. And it's more, if you look at it, it's more from a perspective of breaking news. It's more sensationalism rather than looking at it from a perspective of what are we doing about this? How can we help? But there's more gory details about it. So to answer your question, Dr. Mata, here in Zambia, it's not that I cannot say that there is a rise in suicide because there is no pre and post, statistics to show that. But from a health perspective, from a person who's been seeing patients coming in with self-harm thoughts and self-harm ideations, it's nothing that is new. Suicide has always been there in our country. It's just that there is now more sensationalism. That's what I would say. So yeah, that's the real truth, Dr. Mata, about suicide.
Dr. Dahl, you've used some interesting words there. I heard you say self-harm, suicidal ideation, suicidal attempt, and actually committing suicide. My understanding and in my practice, even going back, it's people think about and talk about suicide, but there are other ways that people can self-harm. I remember we've had patients who would cut themselves, people who would uh, swallow dangerous objects, things like that. And I've always wondered, in terms of when you're thinking about mental illnesses, are there any particular mental illnesses from like some of the ones that we've discussed? Are there some mental illnesses where things like self-harm and suicidal ideation and suicidal attempts are more common than in others?
Yes, Dr. Mata. So the reason why I use terms as self-harm, completed suicide, suicidal ideations is because I would like to bring light to understanding how to explain it to people. Um, First of all, suicide is no longer a crime in our country. It is a notifiable action to the police system, but it is not a crime. So that's one thing that people need to understand. And oftentimes, statistics show that oftentimes when individuals do carry the act of self-harm out, it is in the spur of an emotional storm or psychological storm that they're experiencing. And when they feel better or when they are in a better state, they often do not want to actually carry the act out. And also to create this awareness that, in as much as people do die by suicide, we need to honor individuals that are bereaved by and grieved by individuals who have lost their lives to suicide. So instead of using words like committed suicide, we often want to give that support and care to the people that are grieving or bereaved by suicide and say died by suicide. Because Dr. Mata, again, coming to statistics from mental health, for every one suicide that has been completed, 25 other people in that network or in that socioeconomic class or in that community will also either think about it or either attempt. So for every one suicide, there's actually a 25% risk in that community. So when we're talking about a country or a city like Lusaka, for every suicide that is happening, and any person who's even reading about it on social media, 25 other people may actually carry that act out because of that. There is that ripple epidemiological effect. Then again, for every one suicide, there are up to 60 to 100 people that are bereaved by that death. So we need to honor those people and allow them to actually grieve their loss as well. So this is why I use terms that are more supportive, and this is also creating that public health awareness that, look, in as much as we are discussing this, we have to be aware and sensitive about it. Then talking about suicide and the question that you posed to say, are there mental health illnesses that lead to a complication of suicide? Yes. But again, talking about completed suicide is when individual harms themselves and in that process actually dies by suicide. The question is, why would someone self-harm or have thoughts of not wanting to live? When we talk about youth in particular, adolescents, young ones, as well as youth below the ages of 30, oftentimes it is not that they want to die, but it is because they want to distract from that emotional pain that they are feeling. Now, again, coming from a specialist perspective, this is brain health. There are different chemicals and neurotransmitters that are firing that leads to that emotional pain, which is not seen physically. So oftentimes, to distract themselves, they want to feel something. They want to feel that psychological pain to be seen. That is why they often self-harm, to distract from emotional pain. Sometimes it's to release tension that they are feeling. Sometimes it's to feel something. Sometimes it's to express themselves, or other times it's to self-punish. Okay, so oftentimes understanding that youth do not want to die by suicide is very key. And youth are not attention seeking, nor are they weak. So these are points to understand with respect to self-harm. And this is all mental health. It is not mental illness. But then on the other hand, we have mental health illnesses such as bipolar mood disorder. Bipolar mood disorder is where individuals have experienced and extremes of feeling very excitable, very high, and very low mood. And this is because there are clear neurotransmitter or chemical imbalances that are happening in the brain structure. This is why these people feel this way. Now, when people are living with bipolar, there is a 3 times risk of them actually dying by suicide in the extremes of moods. Then also individuals that have clinical depression, up to 4 to 5 times increased risk of dying by suicide when an individual is diagnosed with clinical depression. Okay, then we have individuals that have schizophrenia. This is where they have psychotic symptoms. They see things that are not there. They hear things that are not there. Again, Dr. Mata, I need to guide to say this is not someone who's just behaving bizarre or aloof. No, this is clearly the brain that is not able to have those neurotransmitters, in check. And this is why they see things or hear things that are not there. Again, there is treatment for this, but these individuals can, in that moment when the brain is overwhelmed with the chemical neurotransmitter imbalances, they may actually carry the act out and actually die by suicide. Also, individuals that are having substance use disorders, such as alcohol and other drugs, oftentimes in the spur of the moment may die by suicide when they're actually in that cycle. So there are a lot of mental health illnesses that can complicate to suicide, but majority of the times when it comes to youth, it is not a mental health illness. Majority of the times it's actually a psychological storm that they're feeling and they're actually experiencing, and they carry that act out, but later on, oftentimes do not really want to die by suicide.
Yeah, that was a lot to unpack, and there's some really key things I want us to talk a little bit more about there. Earlier, when we just started, you mentioned the stigma around mental health, mental illness, and suicide. And then you brought to attention that suicide or an attempt to commit suicide is no longer a crime. And I remember situations in the past where people who were found after having attempted to end their own lives and had survived the event would then be arrested, they would be beaten, they would end up in jail and charged. And just trying to imagine for someone who is going through an emotional storm and that storm led to an attempt at suicide, and then having to go through all of this blaming, all this harassment, and just being handled in this very aggressive, very confrontational manner in our system, how negative an impact that would have on someone going through something that led to them attempting suicide in the first place.
Yes, Dr. Mata, and that's a good point to raise, and it's something that we need to understand, because in as much as we do talk about mental health and suicide, we also need to talk about our own inherent culture and our own belief system in our country here in Zambia. So we are prayer warriors, we are a religious country, and oftentimes we also have to look at our spiritual self, which is a key part of our mental health and well-being as well. So when you look at that background and from the onset of that understanding, suicide from all majority, I would like to say majority of religious points of views, is actually a taboo or a sin. So again, if you look at most of the laws that we have, often also stem from religion as well. So there is that belief structure that we also have to communicate. From the religious perspective, it is a protective factor, I must say that. However, we also need to understand that if we're saying that suicide is a sin or suicide is a taboo, what is it that we are doing to prevent that sin or to prevent that taboo? So these are conversations that need to be openly had in our culture and in our system as well. Then also talking about culture, Dr. Mata, I also was very enlightened more recently when I traveled to Northern Province in Zambia and at Chishimba Falls. And apparently there's a folklore around Chishimba Falls where they say that there is a story of self-harm and suicide there, where Chishimba Falls and Kaela Falls, there's a story of suicide around that. And I bring this up right now because, Dr. Mata, mental health and mental illnesses, majority of them are biological in nature. What do I mean by that? Genetics. We inherit these genetic patterns in our brains as well, and our neurotransmitters as well. So majority of mental health illnesses are actually running in families as well. Just the way we have high blood pressure in our country, we have diabetes, sugar disease in our country. Similarly, we have mental health and mental illnesses that are running in our country. But it's because of looking at the background of how we have been viewing mental illnesses. That is why we are not able to openly talk about it. But if we were to do an assessment or prevalence or census of how prevalent mental illnesses are in our country, then we are going to learn that it's actually, generational as well. So coming back to your point, suicide is no longer a crime. It is a notifiable act to the police system, the justice system, but that too is notifiable because it borders on safety and self-care as well. But otherwise, even our mental health act as of 2019, which we have as a country, which I am personally proud of, actually guides us to say, look, concepts and communication when it comes to suicide has to be now more transparent and more open.
Okay, I don't know if you want to jump in with any questions and comments. I've been hogging the conversation.
Thank you very much. Maybe, sorry, I've joined in late. You've talked about how society comes about. I'm trying to bring it now to us. How am I able to tell a friend who's going through, let's say, mental health issues and has got plans of killing himself or herself? I'm asking this because we've now seen, I think, in the past 1 or 2 weeks, we're seeing people go on to post and say this world is unfair. Later on, the person kills themselves. So how can we help one who's going through such?
All right. So one thing again I need to highlight for the listeners is that when a person posts as such, it simply doesn't mean that that is why they're actually dying by suicide or want to die by suicide. That is oftentimes a reason to say I need help and I need support. But there is actually a lot that that person has gone through. So there is the concept of load bearing. How much is it that someone can take in life? And once they reach their limit, no matter how much more you give them, they're unable to, take that load. So if you were to do a thorough assessment in that individual, you come to realize that it's not the money that that person is dying because of, or it's not that relationship that that person is dying because of. There's literally a whole model of growing up, the background, the various stresses that they faced. And of course, there's also the concept of genetics, familial patterns of problem solving. And of course, there's also the social and the societal views and the background on that point. So I'd like to make that very clear. And people need to understand that we need to move away from sensationalizing suicide to one cause. It's not a cause and effect. There are a lot of other factors that need to be seen. It's like what we call the iceberg. Tip of the iceberg, you actually see it on top because the water just allows you to see the tip. But there's so many things underneath that people are unaware of, that people need to be aware of. But then what are you need to do, when a person posts, say on social media, which is why we're having this conversation, we need to actually understand that what are the risk factors that an individual that probably posted on social media has. Does that person has an identifiable or has that person been diagnosed with a mental health illness or mental health disorder? Or is that person using any kind of substances or self-medicating with other things like alcohol? Has that person had a prior suicide attempt or self-harming attempt? Is there a family history of suicide? You also need to understand, is there family violence in their past, including physical or sexual abuse? Because again, that's something that we can't go away from as a country. In Zambia, it's very prevalent. And as of last quarter, I would like to say this statistic again, here in Zambia, Save the Children Zambia, as of last quarter of 2021, say that for every 3 hours that passes by, a child is molested, both a boy or a girl child. And those are only the ones that have been recorded. We still have others that are not recorded. So if there's that family violence, you need to understand that, there's that risk factor. Has there been a history of, interpersonal violence or gender-based violence in that home? Okay, has there been exposure to suicidal behavior of others, such as family members or peers? And this is where I come back to that statistic that I shared earlier to say, for every one completed suicide, there are 25 other people that in the same community, in the same network, are actually thinking about it. So you see, it's not as simple as, oh, this person posted and they're going to carry the act out. You really need to look for all these risks as well. So now that we are on a virtual world where we are all online, again, we are all at risk by just these risk factors that I've shared, which are evidence-based. Then the other things that you need to look for in terms of signs and symptoms are um, just that. Are they actually talking about it? Who are they? What are they actually saying? Because you need to be open now. As a society, I actually urge everyone to say, let's be open, let's talk about it. Because there's a myth to say, if I talk about suicide with someone, it means I'm promoting it. That's not true. This is something that people need to understand. If you're going to talk about it, it means you're giving that person the opportunity to share their concerns, and they will be better able to find a solution to that concern that they have. You also need to look for, if you have a loved one or a friend who actually talks about self-harming or suicide, you need to look for, identify if they have identified ways to kill themselves, such as searching online or getting the common means of, death by suicide in our country, such as, taking, um, uh, um, fertilizers or doom. And I'm sharing this because these are things that we equally need to implement as a community. In making sure that things like fertilizers and doom are not just overly easily sold, to curb such issues. Then you also look at the person's risk, because one of the signs you look for is talking about feeling hopeless or having no reason to live. So when you look for these signs, you're better suited to understand how much of a risk this person is at. Talking about feeling trapped or in unbearable pain, which again is very difficult because when you go to our social medias today, majority of people are actually sharing these things. Talking about a burden to others, increasing the use of substances such as alcohol or drugs, feeling very anxious all the time, or feeling very agitated most of the time. Okay, and these are things that you actually need to look for in your friends and family for you to truly understand whether this person is actually going to act on the thought of self-harm or suicide.
So, Dr. Dalal, I'm just wondering, just on your last point, where we're trying to support family members and friends, right? And just thinking back to the last couple of weeks and months where we've seen, especially young people,
Yeah.
harm themselves. As a parent, for example, I'm worried that my son, my daughter, or someone in my care could potentially be having avoid breaching their trust, because then the temptation becomes to confront the child or the adolescent and force them to have conversations with you. It becomes invading their social media, stalking them, for lack of a better term, on their social media, going into their private spaces, really restricting who they can hang out with, that kind of thing, trying to gain control. I know as a parent you would want to know what's going on with your child, but can it also potentially distance you from the child and make it less likely that they would open up and share what they're going through if you do it that way?
So for that one, Dr. Mata, again, it comes to the prior relationship that that guardian or that parent has had with that youth or adolescent. Because when you look at a traditional Zambian home, It is not as open as you would think, where you can have these conversations. So there's already that concern or
Yeah,
that
yeah.
rift between the parents and the children. So oftentimes, if you do have a child that is, eliciting symptoms of self-harm, for instance, they're cutting themselves, and this is also very common. This is something to be concerned about, but not something to be alarmed about in adolescence. And I say this from a specialist perspective, because as I guided earlier, that adolescent or youth is actually self-harming to feel something, to feel, relieve the tension, or self-punish their concerns or psychological trauma that they're facing in that moment. In that moment, I would actually request the guardian or the parents to actually look for a positive adult or a guardian in that same child's life that they can reach out to, who can then communicate with that child, as opposed to that same parent or guardian reaching out directly to their own child. I say this because, as you pointed out, sometimes there is this concern that children have against their own parents, because it's that age of feeling in between. It's that age of feeling, not understood by their own parents. So in these moments, I've often found, for instance, in practice, what we often do is we have a conversation with the child, and you would think that a child wouldn't understand any better, but as long as a child is above the ages of 7 and 8, they do understand some level of insight. And this, what I mean by insight is they are able to have some level of judgment and bearing on their own life. So in those moments, we actually ask the child to say, who are you comfortable with talking to in your family? And sometimes the child would actually say, I don't mind having conversations with my mom. I don't mind having conversations with my dad. But majority of the times, it's often things like, I want to talk to so-and-so uncle, or I want to talk to so-and-so grandma, or I actually want to talk to my older sibling about this because I'm more comfortable. And there are some children and adolescents that prefer talking to their friends and peers. So in those moments, you actually want to create that kind of a safety net, where you involve them in these conversations so that you are constantly understanding where the child is. Because when you become, and we like to call this the helicopter parenting style, where you are literally just hovering over the child, it literally makes it much more overwhelming for the child. So it's a lot to actually deal with, but this is where mental health professionals come in to guide. And majority of the times when we do have certain situations like this, we do call it self-harm or suicide watch, where it's not like, you're just there in the space of that individual who is self-harming, but you're creating certain networks and safety nets around that person so that they don't actually carry that act out. Because as I said, in that moment, that person is feeling overwhelmed, but that storm does go down in that brain. The neurotransmitters do eventually come back to, normalcy, and in that moment, the person will be better suited. So that would be my guide to parents who feel overwhelmed and alarmed and concerned. Please continue feeling alarmed and concerned, but try to find a way that you can, make that adolescent, that youth feel supported, and ask them to say who would they be more comfortable with talking about these concerns.
Maybe just a follow-up question on that. I think during the course of the week, there's been one question that we've been receiving because we've been posting about mental health and suicide prevention. Most of the messages that we're receiving is there any support group where I can go to? And these are people that do not want to open up to people that they're close to. They would want to open up to someone who doesn't know their past or what they're going through. From your recommendation, are there places that people are able to go to, especially youths? Because we've seen during the time that the grade 12 results came out, we saw a series of people, young people, killing themselves. Now, one of the cases that we're following up has been a lady who's just found out that she's pregnant and the man is married and she's been in this relationship for the past 5 years. For their cry of help, where can they go to?
this is where I just rip off the band-aid and be as blunt as possible to say, unfortunately, when it comes to mental health services in our country, we have a very long way to go.
Yeah.
And we will get there. And I am very hopeful because this is one of the things that we are working towards, and I am personally passionate about, and I have a lot of colleagues who are as well. But for now, the silver lining that we have in our country is that we do have a toll-free line that is currently active, and this is what we call, this is Lifeline Zambia. So
Okay.
if you call 116, you will be able to talk to a psychosocial counselor who is trained, and they have also understood the concepts of communicating. And it's toll free, so anyone can call anytime, and you can actually share your concerns and your burdens. Now, again, you may not find the perfect counselor. Everyone is different, so you can always communicate, try, call again, and ask for another counselor. It's always okay. So there is Lifeline Zambia that you can call 116, and you will get through to a psychosocial counselor if you feel you are in a crisis moment in that moment, or you have a loved one or family member that you want to have get that help. But otherwise, physically in person, Lusaka has quite a few private practices that offer mental health services. I know they come with a fee, but with NEMA on board now, National Health Insurance Scheme, and also other insurances that you may be part of, I would actually urge everyone to get on NEMA, National Health Insurance Scheme. And I say this, Dr. Mata and the Medsearch team, because you see, if we're going to create the demand, this is when the services will be available. So there is that availability. Again, of course, many people stigmatize against Chinama, and I like to call myself as a proud Chinama case. So Chinama also have all these amazing services that are available. I will also say that there's UTH Clinic 6 where people can come through. Ndola Hospital in Copperbelt actually has a mental health unit. We have in Lusaka, Kanyama General Hospital, also Chilenje General Hospital, where there are mental health units where people can reach out to. So there are all these options that can be, communicated to. So yes.
I hope Nima will be able to pay us for advertising their service on our show.
One Zambia, one nation.
Okay, we don't want to keep you for long. I don't know if Amataf is able to join. Then I can ask the last question. The last question. I don't know if you have any question to him.
Just two things, and just going a little bit back to what you said and how we're all now connected. So for every completed suicide in a community, within that community, it increases the risk of other people attempting suicide. Now that, like you said, we're a global community, we're all on social media, and that just exposes all of us. Would you feel that then all of us who are on social media, people who have programs on social media and pages, have a responsibility to actually regulate themselves in how they are disseminating this information, because it's impacting all of us? And then the second question, my last question, is just again thinking about the dark side of the very connected world that we live in, and where people have access to so much information out there in terms of they can go on the internet and look for ways to harm themselves. But also the other side, if I am living with mental illness, I recognize in myself that there's something going on. Perhaps I've even been to see someone and then I self-medicate. Oh, I think we've lost Dr. Dalal.
Yeah. But I think your question is very valid as we wait for him to join in. It is more like at the moment, social media, for me, I personally feel like social media is playing a bigger role in whatever people are going through. If I live my life, yeah, he's back. Like I was saying, social media is at the moment is playing a bigger role. You can finish your question, Mata.
Yeah. Sorry about that, but I got a glimpse of your question, Dr. Mata. And yes, this is where I actually say this, that suicide is a society-wide concern. It's not the responsibility of just individuals like myself in mental health. It is actually a whole community's concern, stemming from religious to cultural to health to just basic, education and everything. It all comes in. It's multi-sectoral. And then when we talk about social media, for instance, I personally believe that the key stakeholders that need to really be in the forefront of this are media. And I say this because we need to move away from sensationalizing suicide. What do I mean by that? Every time there's a case of suicide, you just give that gory detail of this is say Naeem, and Naeem has died, killed himself, and this is what Naeem did to kill himself, and it was because Naeem had a loan or Naeem had a family dispute, and Naeem is left by this and this, and that's it. There's no details about where a person who's probably feeling similar concerns or issues, which is majority of the cases the case in our country, to say if you're feeling or if you know someone who has similar concerns, please reach out to ABC, or we have support structures in our country. So the key stakeholders, I believe, are media. And also, if someone or if a social media post talks about suicide, let's not talk about the details. You see, that is private to that individual's decision or action. We just if we really want to share that information, let's share it in a palatable way such that people can honor that death. You see, because that also promotes this thought process in someone who's reading to say, oh, that's a means to my end as well. So yes, that's what I would say, to say yes, we do have a role, all of us do. And of course, I would also say people, the users, like every other person, you and I, when we read something like a suicide, on the comments, let's not go and start cyberbullying and sharing to say, haha, died because of money or died because of a relationship. You see, well, my love, you can die. Say, such things need to really be praised. And I say this because someone may be reading it, and someone may be in that exact situation, and someone who's reading it is having that thought and will read those comments, will feel like, oh wow, this is what society thinks of me, so I may as well, so you may actually give that push to someone. So we have a lot of work to do as individuals who are sitting behind these screens and reading and commenting, but we have a lot of work to do.
Well,
Thank you.
we couldn't have said it way better than the way you said it. For me, my last two questions will be: if someone is watching right now, uh, and they've been having these thoughts, what would be your? I know there are a lot watching. What would be your word of encouragement to them? Like, what should they do, coming from you? And then the last question we usually ask the people that we host if they have the Medsearch Zambia app on their phone. So those are two questions: your encouragement, and if you've downloaded the Medsearch Zambia on your phone.
Okay, so because Dr. Mata is going to not hold me well, I'm going to say, yes, I have Medsearch Zambia on my phone. I downloaded it, and it's an amazing application, and they are pro mental health. So please, 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 download Medsearch Zambia, and it truly is an amazing application which gives you real-time information about health services in the country, and they will soon be supported in many other ways when it comes to mental health. And they do also promote a lot of tips on mental health and well-being as well. And I personally will support them with resources as well for mental health. So please do download it. And then talking about if you're someone who has had thoughts of not wanting to leave, or you've wanted to pause life, or you just feel overwhelmed, this is what I will say to you. It's normal. It's okay. It's not something you should feel overwhelmed about. You should be concerned about it, yes, but it's okay. People think that you may be weak, but you are not weak. Okay, people think that it's selfish. It is not selfish. People think that you are attention seeking. You are not attention seeking. You are simply feeling what your brain is telling you to feel. It is not all in your head. Clearly, there are certain things that are taking place in your brain. It's just that you can't see them. And this is why I would actually urge you to reach out to health professionals such as like myself, or any other mental health professionals. Zambia has clinical officer psychiatrists, mental health nurses that I personally am very fond of. So please reach out for help. The other thing that you can do is call 116 Lifeline Zambia. There will be someone to hear to you. And if you feel very overwhelmed, then just reach out to a friend or family and just share what you feel. If you feel they're going to belittle you or overwhelm you, then please just know that that is not the right person for you to reach out to. But please, before you act on that thought, please get the help, and we are here to serve you and help you.
Thank you. Well, I'll throw it to Mata to close it up now. He's the one hosting us today.
Well, I would close by just saying thank you so much to Dr. Naeem Dalal for agreeing to spend his Friday evening with us. Thank you so much. To everyone watching, if you have not already done so, Dr. Dalal gave a really amazing TEDx Lusaka youth talk last year, talking about the youth are not the problem and about bridging the generational divide. Go to YouTube, look for that video. We shall share it on our page. It's an amazing talk. You guys just have to watch it. And thank you so much, Dr. Dalal, for appearing on our show. To everyone watching, if you have not yet downloaded the Medsearch Zambia app, please download the Medsearch Zambia app free onto your Android and iOS devices. It will give you information about health service providers, including mental health providers near you, where you can access the help that we also desperately need. At Medsearch Zambia, we believe that it's really about healthcare simplified. Until next week, in Medsearch on Friday. Bye, guys.
Thank you. Good night.
Medsearch Zambia app. Healthcare simplified.